Egg freezing revolves around the fact that women are born with all their eggs, and as time goes on, both the number and the quality of eggs is inevitably going to go down. So what egg freezing allows women to do is take a point in time and freeze their pregnancy potential. So the eggs can be frozen at a certain age and then used at a much later age. The age of the egg is really going to dictate your pregnancy rate. Egg freezing is a game changer. It really does take some of the pressure off of the biological clock. So we found in our studies that women really do change their behavior after. They view parenthood differently. Some make it more of a priority. Some change their dating habits. They feel more relaxed, less pressure to find the right partner. They feel that they have more time to really select who they want to conceive with. And some women have said the process has really opened their eyes up to other ways of creating a family, whether it be a single parent through donor gametes. Has been shown to change behavior. It really is empowering for women because it's taking the first step in their reproductive future. Ideally, the younger someone freezes, the more likely the process of egg freezing is going to work. So it may be, the ideal age may be in the late 20s, early 30s. That's not to say we don't freeze at older ages, but the success rates are going to be much higher when you're under 35. The first step is to meet with a reproductive endocrinologist, where you will learn about the egg freezing process as well as overall reproductive health. In addition, usually there will be a physical exam and a vaginal ultrasound. The vaginal ultrasound allows us to look at the ovaries and get an estimate of how we think that you would respond to medicine. Most women are going to start their stimulation on day 2. So on day 2 of bleeding of their menstrual cycle, they'll come in, we do vaginal ultrasound again and blood work. And if everything looks normal, we'll get started. The medication protocol is going to be individualized to the patient. Typically, it's going to depend on the patient's age as well as any previous experience or cycles they've done and their ovarian reserve markers. Typically for ovarian reserve, we're going to do blood work where we measure an AMH and FSH, as well as do a vaginal ultrasound so we can assess the number of small follicles that we think would be receptive to the medicine. You start the injections that night. It's roughly about 2 weeks of injections, 2 to 3 injections a day. That can vary depending on an individual's response. And over those 2 weeks, you're seeing us very frequently. You're coming in the morning, sometimes every other morning, sometimes every morning, where again, we're giving you medications to help stimulate many eggs to grow. So in a natural cycle, your body, there's a lot of small little follicles with immature eggs, and your body's going to select one of these to grow really big and then ovulate once it's mature. What we're doing is giving you injections to grow several of these small little follicles up to nice big sizes so that they're nice and mature when we take them out. And in order to do that, we need to follow you with blood work and ultrasounds. And the ultrasounds give us an idea of how many follicles are responding and how big the follicles are. How far you are into your cycle and what we're seeing on ultrasound, we're ultimately going to pick a day that we think is best to give you what's called a trigger shot. The trigger shot is the final step. It helps do the final stage of maturation for the egg, and it's very specifically timed to the procedure. Retrieval day, you'll get instructions the night before. Typically, you're going to have nothing to eat or drink in the morning, and you'll get a specific time to arrive about an hour before your scheduled procedure. So it's light sedation. It's not heavy anesthesia, but it is medicine that will make you sleepy. So there's no incisions. It's all done through the vagina. And then we were able to take the eggs out, and the embryologist will look at them under the microscope. You may feel a little bit of cramping and pressure, and typically before you're ready to leave, we're able to provide you with the number of eggs that were retrieved. That isn't necessarily the number that's frozen. You will get a phone call the next day. Once the embryologists have time to thoroughly look at the eggs later in the day, they're able to tell which eggs were mature or not. And those are the ones ideally that we're going to be freezing is the mature eggs. So you get a final call the next day on the number that were actually frozen. We often get asked what's the right number of eggs, and that's highly individualized, and it depends on the patient's age. Patient's age is really, the success rates are going to be mostly tied to the age at when the patient froze. So younger patients need less eggs, where older patients need more eggs. In addition, you need a lot of eggs to make a baby this way, and with an egg thaw, you're losing some of the eggs in the thaw process. So you need even more eggs than you would typically need in an egg thaw process. So that's why it's important to go over your numbers. Generally in young patients, we like to have at least 10. In older patients, we'd like to have more towards 20. And again, this is going to be highly individualized and something you should talk about with your provider.